Good morning. Anybody there? I'm 1 minute early, but that's okay. Okay. So I'm just going to set myself up here. Oh, I have one person. Hi. Thanks for tuning in. Just setting up here. All right. Good morning. My name is Ginette Boudreau, and I am the Health Promotion Specialist here at 14 Wing Greenwood. Today's topic of the coffee break webinar is going to be on smoking cessation and our butt out program. But before we get started, I have to talk to you about the presentation you're about to view is the intellectual property of the Department of National Defense, and any reproduction or retransmission of the slides contained in this presentation is strictly forbidden. Some of our topics discussed in this webinar may be sensitive in nature and not appropriate for children. We ask parental discretion for advice. Okay. So, the history of the butt out program. So I'm going to talk to you about our butt out program and what we can do to help you if you're thinking about quitting smoking, and what we can do to help you in your process. So a bit of the history is the butt out program was created because there was no existing programs, smoking cessation programs, that addressed the specific needs and lifestyles of the Canadian Armed Forces personnel. The first version was developed in 1980 and included an extensive evaluation. It was successful. Up to 50% of those who attended the meetings and did the workbook exercises were still not smoking 1 year after the program. Butt Out was officially adopted as an official smoking cessation program for the Canadian Armed Forces. It was updated in 1986, 1995, 2003, and then again in 2010 to incorporate the new concepts and strategies for smoking cessation as they were being discovered. A self-help version of the program was introduced in 1989, and it's being updated in 2003, 2010, and currently the program is being revised as we speak. So how it works. There's no point in telling me telling you that quitting smoking is easy. We all know that it's not. Okay? But the program provides a step-by-step assistance to help you achieve your goal. Many people have quit and have quit using the strategies outlined in our butt out program. For some, it takes several tries before they are successful for quitting for good. But each time they learn something new and increases their chance of success. Smoking is both an addiction and a habit. Okay? The addiction is to nicotine. Effective medications are available to ease your withdrawals. It also has a habit that you have learned. It is also a habit that you have learned, probably over a long period of time. You have learned that smoking does things for you. It may reduce your stress. It may prevent boredom. It may help you concentrate. Now it's time for you to become and learn how to become a non-smoker again. Through our butt out program, you will analyze your reasons for smoking and find other ways and other things to replace your smoking. So, the butt out recipe for success is to help with the addiction by making medications available, and to help you with the habit by solving your problems and analyzing your reasons for smoking, and find other ways and other things to substitute your smoking with. The program is designed for 8-week period to help you through the process of quitting. The first 3 modules help you prepare for your quit day. Okay? Modules 4 to 6 will help you survive the first few weeks of quitting, and the last module will help you establish yourself as a non-smoker. The first 2 weeks of Butt Out, which is module 1 and 2, are very important to learn about why you smoke. Okay? Many people smoke, but do they really know why? Maybe they know why they started, but do they know why they continue? You can cut down on your smoking, but not too much. If you cut down too much, nicotine craving can mask any other reasons you have for smoking. And it will be difficult for you to get a clear picture for your reasons of smoking. You can cut down gradually to about 10 cigarettes a day, but no fewer than that. You may find that cutting down to 10 is too drastic, especially if you're a heavy smoker. Or you may choose not to cut down at all before quitting. It's up to you. You will analyze your reasons for smoking and design a set of strategies or alternatives that serve the same functions that your smoking does now. We use a problem-solving approach called plotting. Okay, so plotting is the acronym for your blueprint, I guess, to help you remember what you need to do to help you with your journey of quitting. P stands for pinpoint. L stands for locate, or LO. T, test, and T, train. Plot. P-L-O-T-T. Pinpoint the reasons for smoking. Nail down exactly why you're smoking. You want to know what function smoking serves for you, and the exact situations in which you depend on smoking. So pinpoint exactly what triggers you to grab for that cigarette. Locate alternatives. Once you have pinpointed your reasons, you are in a position to decide how to handle these problems without smoking. The trick is to brainstorm, to let ideas flow, encourage even far-fetched ideas, okay? You want to get as many ideas as possible. Keep brainstorming, keep the ideas flowing, and then you are going to decide which ones are the most promising for you, okay? Test your alternatives. Test promising alternatives until you find the ones that work for you. A perfectly acceptable solution for one person may not suit another. Even for the same person, an acceptable solution in one situation may not fit for another situation. Be flexible, change an alternative if it doesn't work out, and be forgiving for yourself if you do slip up. Train. Train a good alternative until it becomes natural. This involves ensuring that you use it constantly. It becomes as automatic as smoking used to be. These strategies will help you form your personal non-smoking blueprint. Remember, the acronym PLOT, P-L-O-T-T, is based on the first letters of the 4 key problem-solving steps to help you remember the process. Pinpoint, locate alternatives, test your alternatives, and train those alternatives. Nicotine is an addictive drug. Excuse me. When you stop smoking, you will likely experience some physical withdrawals. For some people, the symptoms are mild, but for others, it can be very intense. Fortunately, there are medications available that reduce your cravings for cigarettes and physical withdrawals. You can choose from a variety of possible therapies. You will assess the level of dependence to nicotine to determine if medication may help you. If so, the medical clinic doctors and/or pharmacists will help you in choosing the right medication for you. Some examples can be the nicotine replacement therapy chewing pieces like your Nicorette gum, your nicotine replacement therapy patch, which is Nicoderm, your Zyban, and your Champex. So some of these have lots of side effects, so it's very important that you talk to your doctor, and if you are on these medications, that you express that you are having side effects if you are, so you can explore a different option. Some people may not require medication, but can use a smoking aid, a quit smoking aid. For example, the level 1, 2, 3 gum, sprays, lodgings, inhalers, just to name a few, and you can also use a combination of these things, not just one. So if you're interested, contact the pharmacy, which I will talk about how you can do that in a minute. These therapies are optional, but experience and research have demonstrated that they can increase your success. They reduce physical withdrawal symptoms, allowing you to focus more on the strategies to deal with the psychological and social dimensions of your smoking habit. These dimensions of smoking habits that linger longer than the physical ones. Addictions, okay? So the social and the psychological dimension of smoking habit lasts longer than the physical addiction part. And more often are the reasons why people relapse and go back to smoking. well after, and this is well after the time when physical addiction remains. The program is designed to support you. The program is designed the program is designed to support you, but only you can ensure the success. I can talk to you until we turn blue in the face, but if you're not ready to make a change, to quit, then the likelihood of success is not going to happen. You need to want to quit for your own reasons, okay? Not me telling you to quit, or your spouse telling you to quit, or work, or the doctor. It needs to come from inside. Part of your participation includes quitting smoking. You might ask, but what if I slip or relapse? Should I keep working through the Butt Out program? The answer is yes, absolutely. If you are still committed to quitting smoking, okay? If you slip, but you slip, but you stop smoking right away, use this as a learning tool. Learn from this event to stay on track, okay? To develop strategies to prevent your slip up again. If you relapse back to smoking regularly like you were before the program, you can still set another quit day and continue the Butt Out program. But remember, sometimes it takes more than one serious attempt to succeed at quitting smoking for good. If you need to take the program more than once, we would be happy to help you. Understanding why you smoke is an important first step in quitting. People smoke for many reasons. Research tells us that most, if not all, smoking can be associated with 11 reasons, which we will explore in a minute. The first 9 indicate the purpose that smoking serves. For these, it's important that you find an alternative that serves the same function. The last 2 occur because you've been smoking for many, many years. Okay? So let's explore the reasons why people smoke. Do you smoke to relieve tension? Okay, so do you smoke when you feel tension from being nervous, worried, impatient, upset, annoyed? For you, smoking can have a calming effect. For energy, do you smoke when you are bored, tired, or want to pick me up? Socializing, do you smoke sometimes only because others are, to create a sense of belonging? To boost your mood, do you smoke when you are lonely or a little depressed in the hopes that a cigarette will comfort you? How about a reward? Do you smoke as a reward for a job completed or a job well done, or as a way of celebrating that you're happy? To avoid food, do you smoke so you can avoid eating? Pleasure, some people simply enjoy smoking. They enjoy the taste, they enjoy the smell. Time structure, do you smoke to fill time when you're waiting? Do you smoke to break away awkward pauses in a conversation? Do you smoke to procrastinate at something new? Smoking may help increase your concentration. Triggered. Do you automatically reach for a cigarette when you have a coffee? When you're speaking on the telephone? When you finish a meal? Go to bed, get in the car, read a book, right? Sometimes I know many people, it's automatic. When they get up in the morning, have their coffee, they light up a cigarette. When they get in their car, what's the first thing they do is they light up a cigarette or have that beer, right? I know a lot of people who don't smoke, but the minute they have alcohol in their system, they're reaching for a cigarette, right? Nicotine. And then this is particularly for those who have the heavy smokers. They have physical cravings for nicotine. This is called a nicotine hunger, may be signaled by a dry mouth, headache, difficulty concentrating, even trembling hands. Do you experience any of these symptoms and smoke to alleviate them? Creating awareness why you smoke can harness personal power for freedom. It can also prepare you for what you need to focus on and when you are ready to make changes and to give quitting a try. Yes, sweetheart?
I want to paint my nails.
Can you wait till I'm done my presentation?
Just how are
They're downstairs. Thank you.
they? Lisa?
Yeah.
No,
Sorry.
You won't let me.
Sorry. Let me finish my presentation, okay? And then I'll paint your nails.
No,
Thank
I
you.
want to paint my nails.
So, record your reasons for quitting. Sorry about that, guys. Just as you have a reason for smoking, you may have reasons for wanting to quit smoking. Think about these now. Ask yourself these 3 questions as you think about your reasons for quitting. What are some things that you value the most in your life? How does your smoking link to these values? How does quitting smoking link to these values? Okay, so I have a table here. I'm going to go quickly through it. I'm not going to go through everything, but I will post this. It is posted actually already in our photo album, the Smoking Cessation album, okay, or But Out. So things that you value that may come to mind may be your health, your children, your relationship with your partner, your work, having enough money to enjoy life, winning at sports, and enjoying time with your friends. And a couple things at how smoking links. So for your health, you may get a chronic cough, teeth and gums are unhealthy, you worry that you may have a heart attack. For your children, you're worried that smoking may influence them to start smoking. You can't afford to buy them extra things. They complain it smells, hurts their eyes, makes them cough. For your relationship with your partner, they may say that kissing them is like kissing an ashtray, right? For your work, you may be losing concentration when you're craving a cigarette, but it's not break time yet. Or I take more sick days because I'm often more due to colds or illness. Having enough money to enjoy life. I have less money to spend on gifts because I smoke. I can't go on vacations because all my money is going towards cigarettes. Smoking affects my ability to play sports. Many of my friends smoke and it helps me feel part of the group when I smoke with them. Okay? But now we're going to explore a little bit of how quitting smoking links to these values. So for your health, if you quit smoking, you'll have fewer colds and fewer sick days. Teeth and gums will be healthier. Less chance of dying young from cancer or heart disease. For your children, you'll be a better role model for your kids. You'll protect them by reducing their exposure to second and third hand smoke. Partner, you'll be more attractive to your partner. Your job performance could improve because you're better able to concentrate. And your relationship with the coworkers may improve because you're not always gone to the smoking pit and having them pick up the slack. Having enough money, you'll have more money to enjoy the things that you really want to do with your family. You'll be able to better win at competition, not let your teammates down because you're coughing up a lung when you're exerting yourself kind of thing. And for enjoying time with your friends, maybe your friends want to quit smoking too, and you could be a good role model to start the process. Just to name a few. So the next part that we're going to talk to is your initial reaction to quitting smoking. This section focuses on your initial reaction to quitting. It also helps consolidate your strategies into your blueprint for a non-smoking lifestyle. Each person's reaction to quitting is different. Here are some symptoms that you may experience or may not. It's different, okay? So, the first couple, when you first start to quit smoking, you may feel irritable or restless, okay? This is your body craving nicotine, and it will last about 2 to 4 weeks. Tips for relief could be walking, hot bath, relaxation exercises. Are you feeling tired? Nicotine is a stimulant, so now with the nicotine out of your body, you may be feeling more sluggish. The average duration of this is 2 to 4 weeks. Take a nap. Get fresh air, right? Take time for personal self-care. Are you having trouble sleeping? Your body is adapting to removing the nicotine, and this can last about a week. Avoid caffeine in the evenings and relax before bedtime. Your initial reaction to quitting, you may start coughing more. Your lungs are clearing out the mucus in the cilia of your airways and are no longer paralyzed by the nicotine. This will last 1 to 2 weeks. Make sure you drink plenty of fluids during this process. Are you finding yourself always hungry? Your mouth misses something when you quit smoking. And this will be 2 to 4 weeks in average duration. Avoid extra stress. Oh, drink plenty of fluid, sorry. Eat something crunchy, chewy snacks, okay? Some sunflower seeds or something like that. That will help. Are you having trouble concentrating? Okay. Your body is adapting to the removal of nicotine. Again, this will last a few weeks. Avoid extra stress. Reduce the workload if possible. Okay. Quitting smoking is not easy. And be forgiving for yourself. Allow yourself to do things that you not normally do. Are you feeling a bit depressed or angry? You miss smoking and you're going through a grieving process. And this will last 1 to 2 weeks. Talk to your partner, talk to your friends. Tell your feelings, and this will help pass. Don't keep it inside. You may be constipated. Okay, the intestines slow down temporarily. Drink plenty of water. Eat lots of fruits and vegetables and whole grains. And your last one is itchy scalp and dizziness. Your body is getting more oxygen. This is a good thing. It will last a few days and change positions often and more slowly, especially for the dizziness part. So, here's some information to help you understand what happens to your body when you quit smoking. Okay? So we all know that smoking is bad for your health for a variety of reasons. But after 20 minutes after quitting smoking, your blood pressure returns to normal. Pulse returns to a normal rhythm, and your temperature of your hands and feet return to normal. 8 hours after quitting smoking, carbon monoxide count returns to normal. Oxygen levels in the bloodstream are back to tip-top. And don't do that, please. 24 hours after quitting smoking, the risk of heart disease decreases. 48 hours, your sense of smell and taste improve. Therefore, you're enjoying more foods. 2 weeks to 3 months, your circulation improves. Walking becomes easier. Pulmonary function increases about 30%. 1 to 9 months, cough, nasal congestion, fatigue, and shortness of breath diminish. Your body regains energy. 1 year after you quit smoking, the risk of coronary heart disease is 50% less than that of a smoker. 5 years, your lung cancer mortality rate of a former day pack smoker is decreased to almost half. From 5 to 15 years after quitting, the risk of stroke disease is comparable to that of a non-smoker. The risk of cancer of the mouth, throat, and esophagus is 50% less than that of a smoker. 10 years, cancer mortality rate is similar to that of a non-smoker. Precancerous cells are replaced. Risk of cancer in the mouth, throat, esophagus, bladder, and pancreas decreases. 15 years after stop smoking, the risk of heart disease is similar to those of a non-smoker. Those are big. Those are big. Other things that may be positive as you quit smoking is your insurance premiums may go down. Insurance companies have taken into account in the research on health benefits of not smoking, realizing that people who don't smoke tend to be healthier. Many companies have reduced premiums on life insurance for non-smokers. You may qualify for a significant reduction on your life insurance policy, depending on your age, the policy amount, the company. Once you quit, call your agent to see if you qualify. Pocket change. The extra money in your pocket is another benefit. You're actually being paid to be a non-smoker. This fact becomes lost since money is often put into another pocket with a pot with loose change. Keep that money for yourself that you used to spend on those cigarettes. Benefits to others. Exposing others to your smoking puts them at risk. Secondhand smoke can cause cancer, heart disease, make asthma worse, increase colds and ear infections in children, and much more. When you are not smoking, you are not only improving your own health and quality of life, but those around you as well. Because kids breathe faster and way less than adults, the effects of secondhand smokes are worse for them. Children exposed to secondhand smoke have more severe allergies, more ear infections, more colds, are more likely to get an asthma or have more severe asthma attacks, are more likely to have problems in school, such as poor attention span or hyperactivity. Third-hand smoke has the same toxic chemicals as second-hand smoke. The third-hand smoke gets trapped in your hair, your skin, your furniture, fabric, carpet, and toys. It builds up over time, and the chemicals from the trapped smoke pollute the air and get into the people's lungs and bodies. So how do you access 14 Wing Pharmacy during COVID-19? Are you interested in quitting? You want to talk to a pharmacist or a doctor about possible treatment plans or medication? Call ahead of time to make an appointment. Okay? The local is 5386. I spoke with Erin at the pharmacy the other day, and they are all for helping you guys quit smoking. Follow all of the COVID-19 regulations that is set on the wing. Okay? Make sure you're remaining your distance. You must register at the CDU, and they will inform you where to go. Just don't walk in. You have to follow proper procedures. There's arrows, there's stop signs, everything's there for you to follow. You must wear a non-medical mask. If you don't have one, they will give you one at the desk. Okay? When I spoke with Erin, she mentioned that they are not fully stocked on their medication, but it will only take 1 to 2 business days to order. She also mentioned that the medication requires a prescription from your medical officer. Okay, so if you're just looking for a quitting smoking aid, the pharmacy can help you right there, but if you're looking for some medication, you will have to make an appointment with your medical officer. They have all sorts of quitting smoking aids to help you, and that doesn't require the referral. Also, we have our Butt Out program. So between the pharmacy and your health promotion office, and with our Butt Out program, the success rates of doing both with the pharmacy and the program are higher, rather than just if you were to go for the medication. Okay, but you don't have to take the program. We're not going to force you to take the program. We know that some people don't like adult learning and whatnot. But just so you know, the research is there that 50% of the people who take the program and do the work and are serious about quitting smoking are successful. For families, family members, and civilians, okay, there are many help programs that runs in most clinics, medical clinics out there. And there are some financial supports available to you if you want to attend their meeting. Now, we all know that COVID-19 has impacted some programs that are being offered. So more information can be found at the following websites, which I'm going to post, is www.tobaccofreenovascotia.ca. Tons of information there for family members and civilians. You can also go to www.nshealth.ca, which will provide you with testimonials and other programs that are being offered. Visit www.811.novascotia.ca or call 811. They will connect you with the people that you need. They will connect you to the resources, to the programs. They will let you know what programs are available in your area. Okay? Questions that you may want to ask your healthcare provider is, how has smoking affected my health? How can I quit smoking? Are there medications that can help me quit smoking? Can you recommend some organizations and some support groups that can help me quit smoking? How can I prevent my kids from smoking? Okay, so those are all some information that you can ask. There's nurses and healthcare professionals behind the lines at 811. Mind you, with the COVID-19 being there, the wait times are a little bit longer. Okay, but you can register online at 811.novascotia.ca, and tobaccofree.novascotia.ca are fantastic resources. Okay. Just to kind of give you a little bit about what the Tobacco Free Nova Scotia talks about, they're ready. You call them to register. If you want to quit smoking, you're ready, you want to try again, you're in the right place. Okay, quitting smoking is one of the best things that you can do for your health. Okay, and Tobacco Free Nova Scotia can help. This is for civilians and spouses. They have a quit line where they have a trained counselor to develop a personal quit plan that's right for you, similar to our Butt Out program. Get help with the cravings and withdrawals, or maybe you just need someone to talk to. The support is there. They also have a text messaging, motivational messages. So you can text smoke free, all one word, to 1-902-700-7700 to enroll in your Stop Smoking motivational message program. They will send you helpful and motivational text messages as you go along your way in journey to quit tobacco smoking. Okay? Secure chat with a counselor. You can talk with we can chat with a counselor right there. There's online forums, there's quick packs, there's website resources, there's English, French, other languages available. Please look into it. That is what I have for our presentation today. Okay? Thank you for tuning in. Please reach out if you want to participate in our self-help Butt Out program. Or if you know there's a bunch of you that want to quit smoking together, we can set up a small group session. My email is 14winghpspecialist@gmail.com. That's for me, Ginette Boudreau, or you can contact Lisa White, the Health Promotion Manager, at 14winghpmanager@gmail.com. Okay? So that's a bit about what our Butt Out program is about and a little bit of information on why quitting would be beneficial for you and for the people around you. But again, you need to make that choice. I can't tell you to quit. Your mom can't tell you to quit. Your spouse can't tell you to quit. Your kids can't tell you to quit. You need to want to quit. So, I will be tuning on the 13th for our Monday short, and my topic that day will be on facts on intermittent fasting. Okay, so it'll be a quick 10-15 minute blur on intermittent fasting. The pros and cons, I guess. And on Thursday, July 16th, Lisa will be live talking about sleep during COVID-19. Okay, so we all know that our sleep pattern has been affected for better or for worse. I'm not sure. But yeah, so she's going to talk to you about some sleep. Thank you for tuning in. Hang in there. Enjoy your day. And we will be in touch. See you on Monday. Take care.